The Western Cape Blood Service, also known as the WCBS, is one of two blood services that operate within South Africa. Donors and patients are its priority, whilst it facilitates the entire process of blood collection, testing, component processing, storage, distribution, and issuing of blood products.
Dear listener, welcome to this episode of the Lifeblood Podcast. I'm Hayley Ali, Hospital Liaison Officer, your host. A warm welcome to Nadia Peterson, who is the manager of the Transfusion Virology Laboratory for the Western Cape Blood Service. I've heard it asked, what tests are performed on a blood donation to ensure that it is safe for transfusion? Firstly, how often are blood donations tested by WCBS?
Okay, so each time a donor donates blood, whether you are a new donor or you've donated 20 times, before the actual donation, blood samples are then taken, which is then sent to the lab, and then we will then test. In my lab specifically, the tests that we do would be testing for HIV, hepatitis B, and hepatitis C.
Explain the approach used to optimize sensitivity of testing conducted by WCBS.
Okay, so we use the latest technology available, which is NAT, nucleic acid testing. And what we do, NAT is more sensitive than a PCR in terms of identifying your virus or detecting your virus. What we also do, which is different from the rest of the world, as in, your first world countries, as in the USA and Europe, we do not pool our testing, we do individual donor testing. So each and every time you donate, each and every sample gets tested.
What is the prevalence of HIV, hepatitis B, and hepatitis C in the WCBS donor population?
So it's very, very small. If we look at HIV, for the last year, out of 148,000 plus odd donors, we only had 81 positives for HIV and then 83 positives for HBV. So for HIV and for hepatitis B, we looking at a prevalence of 0.05. And then for HCV, it's 0.005, in that we only had 3 positives out of that 148,000 donors in the last year.
Explain the tests conducted by WCBS to detect HIV, hepatitis B, and hepatitis C in a blood donation.
Okay, so each donation, as mentioned, is tested, and our lab is split in half. On the one side, we do NAT, which is your nucleic acid testing, which then specifically looks for either the DNA, in the case of hepatitis B, and the RNA for HIV and HCV. And then on the other side of the lab, we do normal serological testing, so using immunoassays, and those include, for hepatitis C, we're looking at hepatitis C antibodies within the bloodstream of the donor. For HIV, we have a dual test where we look for the antigen and the antibody. And then for hepatitis B, we test for surface antigen. So we cannot just on one result decide that a donor is positive. So our first line testing would be that testing that I've just mentioned. And then what we then do afterwards, so should a result be positive, we will then, for hepatitis B, hepatitis C, and HIV, we will then test it on a different instrument, which uses a different testing principle to confirm if it is positive. Then for hepatitis B, because hepatitis B is such a complex virus, we do further testing in terms of, besides the surface antigen, which we will test, and that is our first line testing, we will then, once that result is positive, we will then test the surface antibody result. We then also look at your core antibody for hepatitis B. We do the total. Should the total be positive, we will then do IgM as well, just to see at what stage of infection it is. In addition to that, we also look at the HBe antigen and antibody. So that just shows you nice nicely, or just puts nicely into perspective the stage of infection where we are at for hepatitis B.
Thanks, Nadia. How soon after infection can WCBS detect the presence of these viruses in a blood donation?
So because NAT is so sensitive, it drastically reduces the window period. When looking at HIV, it reduces the window period within 4 days we can detect. For HCV, in about 2 days. And then for hepatitis B, in about 16 days, we'll be able to detect.
And then when will WCBS defer a donor due to HIV, hepatitis B and hepatitis C respectively?
So should the donor test positive, and that includes in our first line and our confirmatory testing, once we've confirmed that the donor is positive, we will then have to defer that donor indefinitely. It's a permanent deferral. But sometimes also, especially with your immunoassays, you will find cross-reactions. And that can be due to either people starting on new medication, you have your athletes which may use supplements for performance, and those sometimes might just cross-react with our reagents. Doesn't mean that they are positive for anything. What we will then do, we will then send them a letter to say that you are cross-reactive, or we found that there are particles in your bloodstream that are reacting with our reagents. We will then ask the donor to wait for 6 months, come back in 6 months, and then get tested.
What safeguards are in place to ensure that an infectious blood donation is rejected?
Sure. So we are SANUS accredited. So I think that already tells you the checks and balances that we do have in place. But the minute that we update a donor as positive on our IT system, that donation will be blocked, which means that none of us, nobody can actually override that unit and then issue that unit to a blood bank. So definitely there is a permanent block, and all that anybody can do with that unit is discarded.
Thanks, Nadia. It's reassuring to know all of the tests that's performed in the transfusion virology laboratory to ensure that WCBS provides safe blood for transfusion to a patient. Do you have a closing message for our listeners?
So for everybody, just to know that we are constantly looking what is available out there, trying our best to stay abreast of technology. Whenever there is something new, we will be the first to raise our hand and say, can we also try? We also participate in research and development. Whenever they are making new reagents, we can then also participate and show how that specific reagent will react within our population.
Thank you.
You're welcome.
We will call it a wrap.
Thank you.
Thank you for listening in. Until next time, do something remarkable. Donate blood.